Hi, my name is Ryan Franklin, and my argument is that the Trump administration did not address the coronavirus outbreak in an efficient manner to meet national security standards. Further, the failure started well before the pandemic reached American soil. In 2014, the Obama administration put together the Global Health Security Unit within the White House National Security Council. The focus of this unit was to create a quick identification, isolation, and response to health security. They also created a 69-page pandemic response guideline playbook. In 2018, the Trump administration deemed the unit unnecessary and fired the head of the security unit. Trump also reduced funding for the CDC Epidemic Prevention Response Unit, resulting in reduction in funding for many countries, including China, where the pandemic began in Wuhan. The administration also sought to repeal Obamacare without providing healthcare alternatives. By December 30th to the 31st, a, a Wuhan doctor warns other doctors to protect themselves from the new illness. China, while they played down the illness, warned the World Health Organization of an outbreak of pneumonia of unknown cause. By January 3rd, White House Security Council were allegedly briefed. The U.S. CDC had informed the HHS security about the outbreak. Germany started working on a test. The U.S. did not communicate any plans. By January 12th, the following happened. CDC communicated warning on disease on January 8th. WHO issues its first warning on January 9th. Trump held a rally telling his audience America's future never looked brighter. The first test was recorded in Wuhan on January 11th. On January 12th, the WHO issues a comprehensive package to deal with how to detect, test, and manage disease. On January 13th, a traveler returns from Wuhan and is diagnosed with the virus 10 days later in Chicago. This was a crucial time to develop a national response. By January 21st, the WHO and China confirmed the first person-to-person transmission of the virus. The first case in the U.S. and in South Korea is confirmed. South Korea utilized nationwide testing and tracing. President Trump said his administration had it under control and that it was one person from China. By May 2020, South Korea had 250 deaths, and the U.S. had 65,000 deaths. Given the difference in population, the U.S. should have been 6 times South Korea, but was 250 times that of South Korea. By January 30th, asymptomatic transmissions is confirmed by the CDC. China shuts down all of the Hubei province. WHO declares a public health emergency. Only then was a U.S. task force formed, but the Trump administration continued to downplay the virus. Trump held another rally on January 30th. By February 2nd, Trump set a partial travel restrictions for China. Please note that 40,000 people arrived in the U.S. 2 months after Trump's restrictions. By February 6th, the WHO was distributing tests around the world, but the U.S. Trump administration said the CDC would produce their own tests. These tests turned out to be faulty. Even with the bad tests, the administration took valuable weeks to ask for additional funding. Because of the lack of testing, the administration continued to quote low numbers of cases and did not create a national plan. February 22nd, after Peter Navarro sounded the alarm of the increasing possibility of a COVID-19 pandemic, Trump asked Congress for additional funding, but downplays any economic risks and says the U.S. has a total of 15 cases and he expects it to disappear like a miracle. The stock market begins to drop. By February 28th, Trump and his allies in Congress support the idea that the virus is a hoax by the Democrats. By February 29th, the U.S. has its first recorded death in Washington state. By March 9th, Trump said it's okay to go to work with coronavirus. New York, Maryland, California, Kentucky, Utah, and Washington state have declared states of emergency. By March 11th, WHO declares a pandemic. Between March 13th and March 26th, Trump declares a national emergency, but tells governors they're responsible for the response within their own states. Many states implement social distancing. As more states implement social distancing and businesses are forced to close, more than 40 million Americans apply for unemployment. Instead of addressing the root cause with a comprehensive national plan, the Trump administration goes to war with governors to open up the economy. The focus is on economic symptoms and not on the health security issue that caused it. Analysts suggest that 90% of the deaths could have been avoided if the Trump administration issued physical distancing 2 weeks earlier. In reality, there still is not a national plan to address the pandemic, and the task force has been shut down. While the deaths in the U.S. are 108,000 and the cases top 1.9 million, it leads the world in both.